Many have heard about the infamous sciatic nerve and know that it can cause low back and leg pain, but most people are not aware of its long-lost brother, the devious femoral nerve. Hi, I'm Teemu, a physical therapist from Finland, and in this video I will tell you how this nerve affects your body, what kind of problems it can cause, and most importantly, how to solve these problems at home. So remember to like the video, remember to subscribe to our channel, it will help us create more awesome health-related content for you. Thanks. The femoral nerve starts at your low back and it innervates the muscles in front of your hip and thigh. It's also a sensory nerve of the same area. Well, first of all, if there is movement issues with the nerve, it can cause the surrounding muscles to cramp up, activate in order to protect the nerve. In other words, your hip flexors, your quads are tight. And if the nerve issue is the cause of this tightness, then normal basic static stretching will not help you, it will not solve this issue. It might actually make it worse, or in the best case scenario, it will not affect you at all. And this leads us to the next part of the problems this nerve can cause, which is low back pain. For example, the tight muscles of the hip and thigh can cause the pelvis to tilt, and this will stress your low back pain. And this will stress your low back. It's also possible that the nerves get irritated because they cannot move properly, and this will cause the low back pain. Last but not least is the thigh, hip and knee pain. Because this nerve innervates these areas as well, then the problems of the nerve can cause pain in these parts of the body as well. Like I mentioned before, stretching the nerves is not the solution. It can actually cause more pain, more stiffness. Instead, you need to do movements that allow the nerve to move with ease. This movement is called flossing. Here you move the nerve from one end while giving it slack from the other one. So instead of stretching the nerve, you floss it. This will gently unlock the movement of the nerve and give it more blood flow. Next we will show you how to do this at home. But before we start doing, first a word of warning when not to do this exercise. If you have any tumors, pathologies in the area, any fractures of the spine, any cut nerves, or any other reasons, medical reasons, when mobilizing your nerves is contraindicated. Or if you have any doubts if this is good for you, then consult your doctor before doing. So we will show you two versions of this exercise. Pick the one that feels the best for you. For example, some people don't want to lie on their stomach. But the first version is by lying on your stomach. Place a pillow under you. It will neutralize the spine a little bit, make it more comfortable. And first you start to move the nerve from the leg, so bend from the knee. And at the same time give the nerve some slack by raising your head. And then you reverse this. Remember to bring the knee all the way up or flexed. Remember to flex the knee all the way. But if you feel any pain, limit the movement, or if the stretch is really intense, then you also need to limit the movement. And little by little, when you do this for a week or a couple of weeks, you start to get further and further into the motion. Also, pay attention to your low back. For example, the tight hip flexors and quads may arch the back, and it looks like this, so try to keep the low back stationary. The best results you get when you feel nothing at all, or if you feel only a mild stretch. Do this movement both sides. 10 to 20 reps is enough. You can also do this multiple times per day for best results. No pain, no tingling feeling is preferable. Next we will show you how to do this while side lying. In the side lying position, you start by placing yourself all the way flexed, so the classic fetal position. The low back is also flexed. You don't allow it to arch during this movement. And then with your knee flexed, you start to bring your leg all the way back, while simultaneously extending from your neck and giving the flossing movement and motion to the nerve. The same basic principles apply here as well as in the previous version of this exercise. So mild stretching is allowed, or no stretching feeling at all, no pain and no intense stretching. If you feel pain, limit the movement. If you feel intense stretching, limit the movement. And also you can limit the amount of repetitions that you do, but 10 to 20 reps is really good amount. Remember to do both sides here as well, and you can do this multiple times during the day. Remember to keep the knee flexed all the while you do this exercise. Don't allow the leg so in other words, don't allow the leg to extend from the knee. Hopefully this was really helpful for you. If you want to learn how to mobilize your sciatic nerve, then check out that video, and remember to like and subscribe, and we will see you again.